Hey everybody, Buck Buckminster back here at Getty Eye Center with Dr. Matt Duggar. Dr. Matt, good to meet you
Nice
today.
to meet you as well.
Hey, we're having a lot of fun here today, but now we got to get down to some serious information because I know there's a topic out there that all America is wanting to hear about, and it's having to do with contact lenses. And while contact lenses have been around for a long time, I know that with the internet, we're seeing a lot of discount contacts and ordering contacts online.
Sure.
And I mean, you can just go and read the reviews of the horror stories that people are experiencing.
Sure.
And I know here at the Getty Eye Centers, you specialize with that. Talk to me
Definitely.
a little bit about eye contact tolerance and contacts in general, if you would.
Well, the big issue with ordering online, a lot of the products are brand name products, but the bigger issue is that company won't follow up with their primary eye care provider, and they'll provide them with old or expired lenses. Okay, when they don't do that and they don't coordinate with the primary eye physician, then the prescription could be off. They'll have a tendency to wear their lenses too long, and when you wear your lenses too long, they'll have a tendency for protein and lipid buildup. Eventually, which will lead to decreased amount of oxygen to the cornea and can lead to keratitis, red eyes, and worst case scenario, ulcers or bacterial keratitis.
So actually, irreparable damage possibly to the eye by wearing the wrong contact lenses.
The wrong contact lenses, the wrong fit. Generally the online sources are reputable name contact lenses, but the problem is the patient will wear them for longer, and they'll give them to them when their prescription is expired.
Wow. Okay. And another thing I wanted to touch on was the fact that not only are people many times finding themselves wearing contact lenses that don't fit right, but I know that there's a difference in lenses and the quality of the lens,
Sure.
and that can affect your short-term and long-term vision. Can it not?
Definitely. It affects your day-to-day life. What some other chains can do is they package their contact lens evaluation and their homemade sort of brand-made contact lens together, which the material isn't as good quality, it's not regulated, and it's not, if you buy a contact lens and you can't go online and find it online, something's a little fishy. They're doing something in manufacturing that's not right. And when patients come in from other offices or they've ordered them online, we just have to get them in the correct lens and get them something that's more comfortable, it's healthier, and get them more functional in their day-to-day life.
Interesting. Okay. So actually ordering these discount lenses online, I really don't know what the quality of the lens is, and I really don't have any idea about any of that. You're going to ensure that, to me, that I'm going to get a quality lens, best fit possible, and the correct lens for my eyes.
Well, definitely. Yeah, that's our goal. Yeah.
Now, another topic I wanted to touch base with you on that I know you specialize in is this issue of pink eye and or red eye, as some people call it. It's not always a viral infection or an issue of that nature. Talk to me a little bit more about that, because I know my son comes home from school, he's describing kids in his class that have what the teachers called pink eye, and they send them home.
Yeah. Yeah, that is the case. That does happen. There is what's called a viral conjunctivitis, which is an inflammation of the tissue around the eye, and that can spread from child to child. However, that generally, a lot of times, is not the case. There are many causes of a red eye. You can have an inflammation of the cornea. You can have a bacterial infection of the cornea. We can have inflammation around our lids, which eventually go onto the anterior structures of the eye. We can have a foreign body, some kind of, I just got done taking a piece of metal out of a gentleman's eye. He presented to me, he had a red eye, he had a pink eye, and he had a piece of metal in his eye.
Oh, my.
You can have severe allergies, which cause red eyes, severe dry eyes, which can be correlated with other systemic diseases that cause red eyes. There's a red or pink eyes. Just because you have a pink eye, it does not mean you have a specific type. And sort of a plug towards an eye care professional in general, when you do have issues with your vision, your eyes are red, your eyes are irritated, it's best to see, ideally, your own eye care professional. You have a good rapport with them, and you can just get better quality care.
Right.
We're all accessible. We should be.
Right.
And we do see situations where a patient comes in, they've been to the emergency room, or they've been to a place that they just don't quite specialize in eyes.
Sure.
and they come in, and what they were diagnosed with might not be the case, and we have to clean it up or get them on the right medication or in the right drops.
Wonderful,
So,
wonderful. Well, it's been a pleasure visiting with you today,
Yes,
Dr.
thank
Matt
you.
Duggar,
Yep.
and I look forward to us visiting again soon.
Thank you.